everyone, welcome to our YouTube channel
A Couple in Germany.
So we make videos related to life, travel, study and work in Germany.
And today's video is an extension or second part of our video on scope for medical professionals in Germany, where we have discussed about medical PG in Germany or how MBBS or dental graduates can pursue a career in Germany. So if you haven't watched the part 1 of video series, then we recommend you to watch that video first and then come to this video. In this video, we will be covering about how one can find hospitals in Germany, what is the application process for German hospitals from India, and what are the salaries for medical professionals in Germany, how is their life in Germany, and much more.
So if you are new to this channel, so don't forget to subscribe, and also we have our presence on Instagram as well, wherein we post regular updates regarding Germany. So don't forget to follow us on Instagram as well. So let's start the video.
As you said, one needs to apply to the state, right? There is no central portal where one can find universities or hospitals. So what are these portals? How can one find them? And if one lands in some state portal, how can they find universities, or which are the better ones, or something on that?
Universities are limited. University hospitals are limited. There, the entry in university hospital for foreign doctors also in the beginning phase very difficult. So one should not aim for that. I mean, one can aim, but it is not very practical to aim for that, I would say. If you are already very experienced, have very excellent language, you have lots of research, lots of publications, if you have that kind of candidate, then fine, you can do that. Otherwise, for normal graduates who are not very experienced, it is a better suggestion, more practical suggestion to apply for smaller hospitals. Okay, in the tier 2 cities, in the smaller towns, okay, where the competition is little less. So that way, the perfect, ranking is not there. What one can see is that, as I have said, that you have to apply to each hospital. To get a job, you have to apply to each hospital. That means you see how big the hospital is, how big the department is, what kind of procedures do they do, what kind of patients do they see. So with that, one gets an idea that, okay, if there is a hospital which has department, a department has 50 beds, or a hospital has 1,000 beds, and that's a big hospital. Then if there is a hospital which has 400 beds, then it's a normal hospital. If the hospital has 200 beds, it's a small hospital. So that way one can judge. Otherwise, as I said, go to the head of the department. Who is the head of the department? Check his profile, what operations he does, what is his CV, and that way how many assistant arts, that is the residents he has. That way one can get an idea, but there is no list as such. And about the state, as I said, that once you've decided that, okay, this is my state, then after that, all the activity has to be in that state only. That means if you find an internship, or you want to find an internship, you want to apply for jobs, you want to book a course for the Fachsprachprüfung, you do everything in the same state, because that makes sense. If you change the state, then every time you inform the medical council that, look, I'm from this state, then they will ask you, then why are you applying to us? Why don't you apply to the state where you're living? Right. So that is important, that you don't keep this tourism, don't do the approbations tourism. People call it approbations tourism because, as I said, people, for example, in Northern Westfalen, since the process is a little faster, people are initial phase very, impatient that, okay, things are taking long time, we want to do fast. They send application to Northern Westfalen, then they fail the exam 2 times here, and now they are worried what to do. Then now they want to go to another state, which is the exams are lenient. Now this is approbation tourism. Now nobody wants that. The authorities don't like this. Then if you do this, your process will take much more time, because you will contact them. They will they will not return you the documents. You cannot just take them the documents back. They will transfer it. And they will take their own sweet time to transfer it. And once the documents are transferred, then at that place, again, you are a newcomer then over there. So whatever time you have done is wasted. So this approbations tourism is not recommended. One has to plan first. And see, the entire thing about the process in Germany is planning. is planning, because it's not very complicated, I would say. I mean, people find it complicated. I say that if you understand the concept on which systems run here, then it is straightforward. Only thing is that what we expect from system to happen is different. We expect things to work in a different way. Here things work in a different way. You have to understand how it is and plan accordingly. Then things work.
So, as you mentioned, like you are here in Germany since 2014 and you have been working in German hospitals. So, can you tell us, like, how is the work culture in German hospitals or basically life in Germany?
Um, yeah, I mean, there are pros and cons. There are goods and bads about each situation that you are in. The life is not as good and as bad as it seems. Important is what the difference that I find here in work culture when we like demarcate it between in work-life balance. Work-life balance is certainly much better here. Here, the residents, they crib that, okay, we are working so hard and we're working so much, but they have not seen how other doctors in the rest of the world are working. Okay, so I have seen. I was in the USA. I have worked in India. So and then I have been working in Germany. So I have seen quite a bit in different parts of the world. And in comparison, I would say life is more chilled out, more relaxed over here. You work, you train, you get your money, you live in a good life, you have your urlaub, like vacations every year, paid vacations. So that is in a more relaxed phase. This is one good thing. Now, when every pros, there are cons. The con here is that the training here is not that stringent and that rigorous like we have in India or, for example, in the USA. Okay, so training is also then laid back. Then, okay, fine, you study, you do. If you want to take the exam in 6 years, you take it in 6 years. If you want to take it in 8 years, you take it in 8 years. It's up to your wish. So nothing much will, I mean, nobody will tell you to. So it is upon your own initiative. So you are not pushed, basically. So I cannot generalize it for all institutes and all hospitals, but this is in general what I have. I have worked in Germany in 4 hospitals now, and this is what I have noticed. So this is one thing that the surgical training, especially people who want to do surgical branches, the initial phases they will not be operating much. I mean, they will be going in the operation theater and all, but they will not be allowed to do things because here the patient safety is of paramount importance. That means that the person who is allowed to operate is the Facharzt. Facharzt is a specialist who has already done his training. And now, so in India, for example, happens that even when you have trained a little bit, you are a little ahead, then you can do things on your own. In government hospitals especially. But here it's not the case. Here you cannot operate alone. You cannot stand alone in the operation theater if you don't have the title of Facharzt. So that is a con, I would say. The training is little laid back. Otherwise, the life in general, language creates a very huge barrier because you cannot express yourself as you would do in your mother tongue or in English. So working knowledge of language we gain over the time, but that fluency on that, what you say, that impactful talking, that does not happen. That is one thing which I feel is little bit like hampers your personal growth and professional growth in Germany. So that is one thing. Yeah, and nice things is that the weather is good. I mean, good and bad is very personalized. But I like the weather here, less pollution, good lifestyle. So that way, these are the good things. Important thing, the problems like corruption and all at lower levels, at least we do not come across that. Healthcare is good. The pension system is there, so social, all the features of social society, social economy is there. So in that way I find it's more secure over here. So here a doctor, everyone as a doctor, one makes good money, but one cannot be super rich like they have in the US, where you earn like $500,000 or $1 million as a surgeon. So that does not happen here. Okay, so here the salary increases slowly, steadily, and so you have to be satisfied with that.
You said like the work culture is different, but like what is the fundamental difference? So like a doctor in India, a doctor in Germany, what is the fundamental difference in the work culture or their attitude?
See, I would see from attitude, I do not say there's any difference as such. In India, also, you give your best to do best for the patient. And in Germany, also, you do give your best to do what is best for the patient. For that, if in India you have to stay longer and do extra work, you have to do that. In Germany, also I said that okay, you have work-life balance, but many situations are that you don't just clock off at like 4 o'clock and go home. You stay a couple of hours extra because if there are less people, as we know that Arztmangel, the shortage of manpower is there in Germany. So here also, instead of 40 hours per week, we work 60, 70 hours per week. But you get paid for that additionally. So the work basically, it is, as I said, that the attitude is the same. That okay, you have to work because you have to receive outcome. So there also in India also, if you want good outcome from the patient, you have to give effort. And here also it's the same that way. Difference I would say in that is a collegial environment. Like here, it is more what you say, flak hierarchy. So the hierarchy is not very steep. For example, in India, when we sit in a conference, in a meeting, anywhere, if anyone senior to you, even 1 year senior to you comes, then you stand. Like when a chef, the head of the department comes, then nobody sits. If there is no seat available in the meeting room, then a resident will make place, and so that the head can sit. Here, I have seen it many times that it's not like that. Okay, head has come, so he will sit on his seat, and you don't need to stand, you don't need to wish, you don't need to be attention. You can do what you like. You can, like, the hierarchy is very flat. And if I have also seen in meetings that okay, all the seats are occupied, so all the first year resident is sitting, and the head of the department who has come late is standing on the corner because he has no empty seat. So this would never happen in India. So that way, so here the system is so that nobody feels bad about it because they find it's normal. Like someone who has come late, all the seats are full, he will stand. Okay, so these things are there. Otherwise, from the patient, this was about the like among the doctors, this behavior. When you say about patient-doctor relationship, I find here patients are more respectful. They are more considerate. I mean, there are different kinds. You cannot generalize it because there are different kinds of people. Everyone behaves differently. They're also in different situations. They're in more stress, more pain, and you cannot expect very rational behavior from them all the time. So, having said that, here working in Germany, I feel actually safer when I'm in comparison to working in government hospital in India. I've worked in government hospital. I've worked, as I said, as a medical officer in near Pune, in Rajgurunagar over there. So those things do not happen here. The violence and all those things. Here also they say that okay, you see on news that okay, violence and all, but the level here, if somebody shouts at the doctor or nurse, it's considered a violence. Okay. So here, intimidation or threatening. In India, it has to be much more than that to consider it to be violence. That is normal. Yeah. So also another thing is that here, one negative part is that you don't have much value. Basically, in India, as a doctor, if you wanted to visit another doctor, okay, and some family problem, anything you want to go there, you just make a call. You have that superiority, importance. You get importance, especially in hospitals, being a doctor. So here, if I want to go to another department, if they're known person, I will just call them, fine. But if an unknown hospital, unknown people, there, it will not happen that, okay, he's a doctor, so he'll go first. I will also wait for as long as with other people in the line, and then when the turn comes, then I will go. So that you feel, I mean, as I said, pros and cons.
Can someone change their specialty in Germany? Like, for example, you are doing orthopedics, right? And you want to change the specialty.
Yes, one can change the specialty. See, the thing is that one has a plan from the beginning, right? I want to go at least in this branch. Somebody will be knowing, okay, cardiology or gastroenterology, that is for later. But internal medicine side, he will be knowing. So the initial 3 years are the common trunk for internal medicine. And for orthopedics or surgical branch also, initial 2 years are common trunk. So one can start, if someone wants to become as an abdominal surgeon, for example, a gastric surgeon. So his training and my training for initial 2 years are common. Okay, so after those 2 years, when he has seen gastric surgery also, orthopedic also a little bit, so then he can decide that, okay, what do I want to do? So even now, but like after, for example, he decides that, okay, I want to do gastric surgery and starts gastric surgery, does 5, 6 years, and later on thinks that, okay, now I want to do orthopedic surgery, then he can do that. It is allowed. Only thing that the entire thing will not be counted as a training. That means he'll have to repeat certain parts of the training. Okay, so flexibility is a very important part here. That's why I said that for newcomers who come, even if someone wants to become an orthopedic surgeon, he should not focus in the beginning on the orthopedic thing. He should take any job that he's getting at the doctor job, like if he's getting an anesthesia, neurology, internal medicine, any branch that he's getting, he should take it till he gets his approbation and gets some idea about how the system functions and make some contacts. So he will be earning salary in that time. So that gives a stability when you have a monthly salary. So and then when the time is correct and when you get an opportunity, then you can switch the branches.
So now let's talk about this salary. So like if you can generalize what are the average salaries here, and also like in terms of the hierarchies.
See, about the salaries, I mean, in India, I mean, here in Germany, there is a tariff system, that tariff Vertrag you have. That means everyone knows what I would be earning or what a first year resident will be. When I say someone that, okay, fifth year resident or sixth year resident, they can just Google that, okay, table for fifth year assistant arts in orthopedics. And then there's an entire table. They mention brutto income. That means before taxes, how much you will be earning. So I will not say brutto taxes because I don't remember the brutto taxes, brutto salaries. I will tell the netto what one gets. For a first year, when someone begins, okay, I'm talking about a single person who comes alone. He will be earning in the beginning around 2,800 to 3,000 euros or 2,600 to 3,000 euros in hand after deduction of your health insurance and all the Abgabe that is there. That after deduction of that, that will be the initial salary for first few months till the person becomes dienstfähig. Now, dienstfähig means capable to do night duties, capable to do emergency duties on the weekends, capable to do extra duties. So, because initially when one starts, one is not capable. One needs to learn the system and everything. Okay, or after a few months, one can do that. So once one starts doing that, then your salary increases 30% approximately. Okay, so for like 6 duties, one earns around 1,000 euro or something, 800 euro in the beginning phases. So it will become approximately 3,600 in the beginning phases. Now, every year the salary increases. But the increase is not very significant. It's really small increases. But then by the end of your training, you earn something around 5,000 to 6,000 euro netto after all the exclusions. Also, the tax system plays a role because if you are taxed to for class 4, so depending on how much tax you are paying or you have to pay, your salary changes little bit. But this is a gross idea one should have. This is about residency. And after residency, once you start working, like you're working here also, but after a specialist title, your salary increases little bit during your working as a consultant, as a Oberarzt. Important is that once the difference between working as a doctor in a hospital, salary-wise, is very different to when you have, if you work in a private practice. Okay. So if you have a private practice, then your salary will be contract based. Like you can negotiate with the owner, or if you have your own things, then you can do it's a business then totally.
And do you have any idea for dentists as well? Like what can be the salary range?
See, the dentist salary range is a little tricky here because they don't have this exact system like the doctors, because they work right from the beginning in the practice, the private practices. Okay, so there. Initially, when they don't have approbation and all, they're exploited basically because they get very little money for same work. But because they don't have the license, proper license, but after they get proper license, then they get options for partnership as well. Okay, so depending upon how many patients they see and all. So initially, I would say you can start with 2,000 2,500 euro. I have a video about this. A dentist friend of mine has made a video, and we have it in the course also and the YouTube also. If they go through that video, that will be more explanatory. Yeah.
would be those take-home messages that you would like to give our viewers who have done MBBS and want to come to Germany?
The important thing I would say here is that the road is not easy. It is filled with obstacles. But if you're persistent, okay, if you have couple of years of time and if you have the finances to finance you for this couple of years of your stay, then it is doable. Okay, so one can get into the branch of their choice in Germany. That is one good thing, that the certainty that one seeks in different countries, there is no certainty. In India, you have exam every year, but there's no guarantee that in 2 years you will clear the exam. Okay, so that way it's a more secure pathway. That is one good thing. Bad thing is that the language is a huge challenge. Okay, so one has to keep that in mind, that one can get frustrated in the process. Okay, so these are the two things that takes time, effort, and patience, and some money. So one should, give it a try. It's a good. I am very satisfied here with my. I have been here since like 7 years already. So I recommend people to do that. Obviously, everything is not very rosy things, but that is nowhere in the world, right?
So thanks a lot, Dr. Deepak. It was really nice interacting with you, and we got to know a lot about the medical field, like what are the requirements and what are the processes required, like if someone wants to come to Germany.
Yeah, and we are sure like the viewers will also get all the information that they need to come to Germany as a medical professional. So thank you so much.
I thank you once again for having me, and wish you to a very good YouTube life.
So if you are really considering to pursue your medical career in Germany, then we would recommend you to check Dr. Deepak's website. The link is in the description. He also offers online courses such as Roadmap for Doctors in Germany, Roadmap for Dentists in Germany, FSP to KP, and much more. So if you have liked the video, then do like the video. If you are new around here, then do consider subscribing our channel as well as Dr. Deepak's channel, and we'll see you in our next video. Till then, bye.